Hello, Dr. Becky here with Premier Chiropractic. In this video, I'm going to talk about flagiocephaly. It's the flatness of the skull on one side of the head. So sometimes you'll see that flatness right in the middle and the back. This is talking about the one that's on the side of the head. It bulges and pushes the other cranial bones up here, and you'll see asymmetry in the face. And the reason I want to touch on it is because it is very common. There are things where you can prevent it from happening, and it's something that really needs to be caught early on. So this is just another reason why it is important to have, a newborn or younger child, a younger infant evaluated by a chiropractor, because we can notice very little things, very little asymmetries that prevent it from getting worse. So, a lot of times people will come in once they're at that 3-4 months and a big flatness has already started to form, whereas that kind of newborn 1 month, I can see that there is a favoring of one side to the other. One thing, that'll come in is, well, they always like looking to the right. This is pretty prominent. You're usually going to notice it. But there's another thing where they could track to the right, but they can't, they'll move their head to the left, but it's almost like caught or stuck. That's something that I'll notice where mom and dad, thought they could move side to side just fine, and they did have a preference. Once that flatness starts to form, it's very slight. You don't notice it very much until it gets pretty flat. And that goes up to about 4 months. And I think about 4 months, if there is significant flatness, they want to evaluate for a helmet. So if you can prevent that flatness from starting before 4 months, you typically would avoid a helmet in that case. Some big reasons why that is happening is, in utero, either breech presentation, multiples, or the baby got stuck in some sort of way that they were tilting their head or moving their head and muscles got shortened. It's what's called torticollis. Then when you go to lay them on their back, either their play mat or bedtime or anything, they're always laying on that one side. The skull of an infant and newborn is very soft, so constantly laying on a flat surface on one side is going to create a flat spot on the skull. So that's one reason. Another is, just babies in NICU, their weak muscles, if they were maybe premature or there was a reason for them to be in there. And so when they laid down, they always laid to one side. They're going to start liking to lay to that side, and then they're going to keep laying on that side. So there's some playthings you can do with them right away as far as tracking and moving. Because it is muscle and a lot of, range of motion of neck, there's a lot of things I'll do here just to make sure they're able to turn side to side. So again, if we're reaching those children at that, 2-week to 8-week mark, it's easier to avoid that flatness as opposed to if they're coming in here at 3 months, the flatness has really started. I mean, if that's the case, we can still evaluate, and there's some things that we can do to try to avoid that helmet. But it's really nice if they get in earlier, and there's stuff you can do to kind of prevent the overall flatness from happening. The other thing that happens is once that flatness has started, then they're always going to that side. They're almost creating torticollis. So either torticollis is going to create flagiocephaly, or flagiocephaly can create torticollis. So since it is such a neuromusculoskeletal thing that's happening, it's great for a chiropractor to evaluate and treat specifically for that. I have had some moms come in, it was kind of past the point of, they were looking at a helmet, it was really flat on that side, and so we treated while the helmet was on to make sure, again, those asymmetries were coming back to normal in the neck, because as the helmet sits like this and is trying to fix the cranium, but you got to get those asymmetries in the neck as well. So that's another thing that we're looking at. Specific to how the kid is doing is how the exercises are going or what age they're at. We do ball play, we do things that you can just continue to do at home to make sure they're improving. And then of course it depends on the age level. Another important thing to note, and there's probably many things, if you have any specific questions or you've had a newborn or recent baby and you're wanting to avoid this, go ahead and reach out. But another thing is, I'll ask the parent, are they always laying to the side? And they'll say no, which is fine. They can move it that way, but maybe when they're in tummy time, they're always looking one way, or maybe vice versa. In tummy time, they can move pretty freely. Now you go to put them on their back and they're not. They're engaging different muscles, so it's important that there's full range of motion throughout the neck, in both ways and all muscles. So any specific question on this, always feel free to ask or reach out. I'll post a couple links below. But like I said, I think the biggest deal about this is the flatness comes on so fast. So the parent didn't really recognize or notice that it was happening, and now all of a sudden the child has a flat spot, or they said, well, I saw a little bit. I think a few things that I've read say it can, the dramatic part of it can happen within a week span. So just making sure that you're on top of it before it gets to that point. Different kids, of course, are going to be differently, or affected differently. It depends on how often they're on their back and things like that. But again, I always, try to give you things to do and things to avoid specific to the child's needs. So go ahead and reach out if needed, and I look forward to seeing you.